this is not my field. Those of you who are coming from communities know much better how citizens benefit. Of course, we are heading for the increase of a profile of active living, improve coordination of existing services, ensure access to appropriate activities for all, structural support, though I think this will be all major aspects of the concept. Presently, I think we have this double strategy. This is at least an idea. There is a participation program. So each community, of course, can apply or can ask for the material. The toolbox might get some consulting. We even have to think about people who are going to a city. So we are getting requests from cities asking us to send somebody there. They would pay for the airfare, they would pay an honorarium. So for example, representatives from cities like are present here today might be prepared to send somebody to another city to cooperate and to consult for 1 week. But at the same time, we are looking for this certification program for those cities that have already been doing an excellent job, to give our credits and to have some role models. And some of the criteria we will be discussing later will be what are the criteria. This is concerning the certification, selection of cities, certification process, and so on and so on. And of course, what are the criteria to be called an active city? For example, for me, and Reinhard Rasch from Paderborn will talk about this, you need some sort of a written paper. Some cities in Germany, they just work from one day to the other day. But you need a plan, you need an idea how to reach your goals in the medium and long run. So you need a written put-down development plan, infrastructure, commitment of government authorities, private enterprises, participation programs, up to media support and evaluation tools. We have been talking about partners. We are in the process of integrating this program in our new Memorandum of Understanding with the IOC. So, coming to the end, coming to the conclusion, once again, remind you what I've been saying at the very beginning. There is, by now, a clear political will by most of the governments in the world to give some sort of support and assistance to the development and promotion of sport for all and physical activity. This is a clear result that by now the benefits of physical activity and sport for all, not just only in the health field, have been widely proven. I know that many universities are still working on that, which is all important, but we have major factors which we can use to give academics and scientific support to this idea. However, what we need now, and many countries, many communities are in this situation right now, they need programs. They need grassroots ideas how to translate the political will, the scientific proof, into activities, into action, into daily action. This is one of the major challenges we have to observe worldwide, not that much in Germany or Finland, but in other regions and continents of the world, and this is all important. What we are designing and discussing about during the next couple of hours should not only be for the developed countries. It should also be of benefit for other continents, for other regions, even though I can state that they also provide excellent ideas and excellent concepts which we can use for this concept. I just had the chance a couple of months ago to be a witness of one of the, from my point of view, best programs in Latin America. Bogota. It's called Ciclovia. Every Sunday morning between 6 and 1 o'clock, 120 kilometers of ring road around Bogota is closed down for public transport, for cars, for buses, and within 1 minute, starting at 6, those streets, those roads are taken by sport people, on the bike, running, wheelchairing, all sorts of activities, and at 1 o'clock punctually, the whole magic is disappeared. Cars are again on the roads. It's a perfect modification of a city, and at the same time, in the wonderful parks and lawns of Bogota, there are classes for volleyball, aerobics, and so on. So it's a perfect program developed by a city in Latin America. And we are right now discussing and negotiating with the City Council of Bogota to allow TAFISA to spread this idea as a concept, maybe even a licensed concept, worldwide. But there are many other good ideas in other continents as well. So my attempt indeed was to, even I know that most of you are so much involved. You have done it all. You are representing a city. You know about the daily challenges, sometimes problems, threats, sometimes opportunities. But still, it was my attempt to transfer a little bit my personal infection for this program, to really give you all our commitment, to give you our idea, and to once again not only thank you, but also provoke you to help us to work on this program, because without your help, without your support as experienced leaders of sport in a given community or city, we can't do it. And that's once again my great hope and my sincere intention to have you with us and help us over the next couple of hours. Thank you very much for your attention, and I'm indeed looking forward how this workshop will proceed. Thank you very much.
I think that I share the views and opinions of the audience here, that thinking about the development and implementation of an important idea and concept and later on program, then TAFISA is obviously the organization on the civic side that can really realize the great challenge. And I really admired the very logical and far-reaching planning what has been done here, and so I think that this is a very good, very realistic basis for us to really work hard on the topic we have. There are good possibilities to realize it. And one other thing is that it's interesting, you certainly haven't borrowed anything from anywhere, but knowing the WHO work quite well for 25 years, 30 years actually, and to the healthy cities and so on. So physical activity was not easy to get into WHO at all, and it really is on very weak position there. But fortunately it is there. But healthy cities was one setting which WHO promoted very much, and also healthy hospitals and healthy homes and healthy traveling even, and all kinds of healthy. But physical activity actually never was included in the healthy. It was social aspects and other things. And so you have now the active cities, active hospitals, perhaps active senior homes, etc., etc. And the basic idea is in a way the same, and it's very good. Then one thing for selling the idea, I think, you mentioned that the benefits of physical activity are well known, but they are still studied. And that's important. They must be studied continually. But one aspect which is not very well studied and not very well demonstrated are the economic benefits of physical activity, and especially cost-effective realization of physical activity. And that's something what also we should try to promote, that kind of research and findings would come more available, because they are actually a very key aspect in selling physical activity to the politicians. And we had to sell the idea of healthy cities or active cities to the politicians, as you said.
Yes. Thank you for your comment. Well, yeah,
I should add one challenge more in the list of three of them, and this is the aging of population.
Demographic.
Yes, it's actually this is really systematically in the program of the report of the cities, but we are going to get that now. I think these aging people are pretty important. Well, something else. Well, from Finnish point of view, I think that this active city, active municipality is really important in terms of having here in Finland the situation that the door of municipalities is pretty, you see, crowded in terms of having a rush hour, you see. So many organizations are interested in cooperating